Okay, read me it out loud.
Diaphragm.
First step.
First step. Warm up abdominal wall. Do inferior glides around the inferior edge of the rib cage 4 to 6 times.
Okay, so inferior, we're just warming up, coming around the rib cage. Now, whenever we work anything in the abdominals, you always want to check for an aortic aneurysm. So it'll be on the right side of the body. It'll look like this under the blanket. If she had an aortic aneurysm and this was her stomach, this is what you would see.
Oh, okay.
Okay, you would see the skin moving and it would look like a frog under a blanket. Okay, if you see that, they may have ruptured their aorta. You send them to immediately call 911 and get an ambulance immediately. Okay, so you'll feel pressure. You'll feel pressure and stuff, but you're not. You have to be able to see this thing moving and jumping.
And they wouldn't know.
That's on the right side?
Some people don't pay attention.
I'm just saying, if I feel something moving on my stomach.
Okay, so this is just gentle warm up, gentle glides, just working around the base of the rib cage. I'm just doing a supported fingers around the diaphragm here. That's just a little bit of a warm up. Then I'm going to have her work with her breathing. So I'm going to have you take a breath out, push all the air out of it. So that was in. Now just force it out, and I want you to contract transverse abdominis. We'll squeeze the lateral ribs tight. Squeeze, squeeze, squeeze. I want to feel contraction. Keep going, keep going, keep going, keep going, keep going. That's it, that's it. And then open your mouth.
It's like she has a taper. All right.
See how the ribs opened up immediately, and she didn't have to suck anything in. We spend most of our lives sucking air. Sucking wind. Could be possibly. I mean, it could affect the diaphragm and the digestion. But see, when she exhaled, her whole head came to it.
Right.
So she's not going to walk around with normal breathing every time she wants to breathe and contract her transverse abdominis. She can't because her head falls forward. So she's going to stay in this dowager hump, and then she's going to breathe in through here. Because every time she really wants to do a normal breath and exhale all the way out, she'd be like this, and then she'd stand up, and then she'd go. So that's just not a normal, so she'll end up staying here and then just breathing, shallow breathing, and then neck breathing in her scalenes and stuff. So that's why you work diaphragm, you separate pecs, get them this way and spread them that way, lengthen the abdominals or shorten them depending on where they're at, and then releasing diaphragm, psoas, and iliacus. And that'll start to change how the pecs will lift the shoulders up, the abdominals will have a normal spread, not over lengthened or shortened. Okay, so the warm-up is just some nice glides. The knees always have to be bent to shorten all the abdominal muscles. So she's good, but she's crossed.
Oh, sorry.
And the next step, number 2.
Number 2, treat diaphragm. A, with palms firmly press ribs medially. Then hook fingers inside ribs. Use static pressure.
This is what it looks like. Boom. So you put a little pressure on the ribs. You come under. This is the side of the liver. You're not going to go that far under as much as you will on the opposite side. So I'm treating, my fingers are coming back under the underside of the ribs. And the pressure is between my palms and my fingertips. So your outside hands where the palms are pressing is what you're pressing against. Now I'm just starting in the middle. Once I'm here, I think you can tell me what I'll do next.
Reposition to cover the width of the rib cage.
Okay, so I'm going to come down a little bit here. I'm going to come reposition, press a little bit medial, and take my fingers underneath and press back. Pressure's between the palms and the fingers. Go ahead.
May work with breathing rhythm to time the treatment with fingers.
Yep, okay, so we're going to do that next. So I'm just going to span here, just showing you the steps here. Now, what I like to do when I'm having them breathe and I'm holding under here, releasing, I'm going to get her to move her diaphragm with some breathing. So I'm going to release the pressure a little bit. I'm going to have you exhale all your air out. Good, it gets real tight. I can't do anything. Contraction, contraction, contraction. There it is. And open your mouth, put your head back. And then opens and loosens, okay? So when it's opening and loosening, she has this paradoxal breathing is going on here. When she sucks in, it goes tight, which it's not supposed to do. It's supposed to relax. So again, exhale. There's your inhale. There's your exhale right there. And we're loosen up, and then release, and open. And then I can hold here. Now I'm going to go under a little deeper. Now take a breath in. Exhale it out, sorry. And then inhale it up. There you go. So you can work and you'll feel the loosening and the tightening as you work. And that's just up under here. So if your nails are long, Want to make sure you're not. Okay, what's my next step?
Position supine. Therapist goes to contralateral side of table. Now repeat treating across the body. This time use fingers to pull ribs medially straight. Support the thumbs treat inside ribs.
Okay, this is what it looks like. So this is one method, and you can do the same method on both sides. This is the other form. What you'll do is you take your fingers bracing the diaphragm here, you slide out and past, and then you come up under.
Oh, I got it.
This way's better, right? Some people like this better. I like this better, personally. And then while I hold static pressure here, I want you to take a breath in, but I'm not going to let you move. Take a breath in. Now I feel it tightening up under the rib here. And then I don't let it go. Now exhale, just let the breath, don't force. There you go. And now inhale. It's real tight. I can feel it moving away and lifting and opening the ribs. And then exhale. Forces the air out. It relaxes the muscle.
That's so cool.
It relaxes the muscle. And then inhale. Tightening of the muscle. It's dropping down into my fingers. And then exhale. It lightens it up and softens and loosens the muscle. So there's no more contraction. Now does that make sense?
Contraction, no?
Yes, yes. Exhale, contraction, yes.
Ready? We'll do it again. Ready? All right.
Just did it the other way around, no?
No, you just messed it up. This is a, yeah, you just messed it up.
Is there more?
Am I messing it up? Am I saying it wrong as I'm doing it?
No, no, no.
No,
close
Is there
it.
more? Could it
What's
be
that?
Is that all
No,
of it?
that's it.
Could it be that